Tim, good to meet you. I'm Ugo, and
Good
thank
to see
you
you.
for joining us here today. We're here at the Twickenham Stoop, in my home changing room, where I spent 14 years, and if these walls could tell stories, they would tell the best stories out. But we're not here to talk about my stories and focus on the rugby days. We're here to talk about the prostate.
Sure.
I felt during my career, I knew everything there was about my body, how to control it, how for it to recover, the nutrition, everything. But the overarching element of health and the importance of it, I was probably slightly undercooked in that. Am I alone in that?
By no means, no. I mean, men in particular, my generation in particular, it's just not on our radar. It's really not something we tend to talk about.
Well, I know people are generally fairly active, but when you think about the gym and health and fitness, we're talking about beach body ready and getting ready for this holiday and that holiday, how much you bench press, what you can squat. But the overriding conversation around health, why is it that men in particular aren't so good at having that conversation?
I think men are fixers. We like to wait until something's gone wrong and then try and find the answer. We're not good at day-to-day maintenance. You don't. If you have a conversation with a bloke, say, "Hi mate, how are you?" "Yeah, I'm all right." You move on.
Yeah.
So we're just not very good at that kind of conversation at all. It's not on our radar.
Why is it that we're more focused on the surface level and the chassis, but not so bothered about what's under the hood?
We can't see it. I mean, if you look, you look at a modern car, it's a load of black boxes, nobody's got a clue. And it's exactly the same thing, I think, and the prostate gland is a classic example because you can't see it.
Yeah, well, I guess we've got to start at the start and understand exactly what the prostate is. So can you explain the function and the use and the importance of what the prostate is for us?
Okay, and all without a slideshow as well.
Yeah.
So if you imagine your pelvis is like a bowl,
Yeah.
okay, now sitting in your pelvis, you've got your bladder and it's probably about the size of your fist. You're aware of your...
Size of your fist?
Probably, in a resting state with a bit of urine in it, your bladder could be about the size of your fist.
Okay.
And it fills up, and you're aware of it filling up. When it gets a bit bigger than that, you need a pee. You go for a pee, the urine comes out through your penis down the urethra, which is the long drainage tube. The other function of the penis, as all men know, is when it comes to having sex and ejaculating. So your testicles, they're little sperm factories, they make the sperm. That has to get out somewhere, so it comes out through that urethra, through your penis. And that's where the prostate comes into it. Prostate is a little gland, it's only about the size of a walnut, and it sits right under the bottom of your bladder, and it's wrapped around that urethra, that tube. And what the prostate does is it manufactures fluid that basically dilutes the semen, and it also provides a bit of extra nutrition for the journey because it's a fair way from the so-and-so's to go. And that's why it's quite important actually to normal sexual function is that you have a prostate that works. So that all drains out through the same tube there. So that's really where your prostate is and what it does.
So it has an integral function into everything that we do effectively?
Yeah, it's not a rudimentary, useless little organ. No.
I'm ashamed to say that I've got to know some of this information, but to your previous point, I've only got to understand and tackle some of this because my dad passed away a year ago. I didn't even realise the prostate was a gland, for example. Yeah. It's so pivotal that we get to know our body way more intimately than what we probably currently do. Would that be fair?
We need to understand our bodies, what's normal for us, not normal for everybody else, what's normal for us. So we know when things aren't quite normal, what things can go wrong, what can we do about it when things aren't quite right.
So how do you know when there's something gone wrong?
Right, if you think where your prostate sits, then there's a couple of things that you might notice. If it gets bigger for any reason, then it's going to do one or two things. It might press up on the bottom of your bladder, which makes you think your bladder's full when it isn't. So you might think you need to pee more often than normal. And then when you do go, because it wraps around the urethra, the pee tube, it doesn't come out as forcefully as it should because it's being squeezed. So those are two of the classic symptoms, peeing more often, particularly at night, or finding that when you pee, it's not as strong as it should be. You can get other symptoms as well, though, if you get kind of infections and things like that in the prostate gland. So you might get pain, you might get blood in your urine, you might even notice blood in your semen. Anything like that or anything else that's out of the ordinary for you, then you really need to go and get it checked out and seek advice. Okay,
you said get checked out and seek advice. Is there any way in which you can self-check yourself?
Prostate is really difficult to self-check because, as I've said, it's kind of deeply buried away inside. It's not something. It's all about just observing how it's behaving.
Okay, cool. And when should you get checked?
If you have any of those symptoms that I've described, then it's definitely worth, as I say, certainly seeking out advice, and if needs be, actually getting properly examined.
So not ignoring it, because
don't ignore it,
as
no.
men, we'll feel something's gone wrong. You might be going to the loo a bit more frequently. Don't ignore it. Just go and get checked.
Yeah, I mean, you have to be sensible. If you've gone out and had 6 pints, you're going to pee more. If you're getting older, it's an unfortunate fact of life. Prostate gland gets bigger as you get older, so you might have to get up once or twice. If you're getting up 4 or 5 times, that's not normal. Get that checked. If you can't pee as strongly as before, get that checked. And obviously things like bleeding and pain and that, they're just not normal, so you wouldn't expect symptoms like that. So those need to be checked out as well.
And is there an age at where you should perhaps just be getting routinely checked?
There isn't any test that accurately diagnoses prostate cancer easily. So there is no kind of routine testing. However, there are things that might make it more likely that your symptoms could relate to it. Things like being aged 55 or over, really, because prostate cancer it's not unheard of. That's the other important thing. Just because you're 30 doesn't mean you can't have prostate cancer, just means it's very, very unlikely. So if you're aged over 55, if you've got a male relative who had prostate cancer, as in your case, and particularly if they had it young, that's definitely worth getting checked out. If you're overweight, that's definitely worth getting it checked out. And also certain ethnic groups, and for reasons we don't quite understand, black men are more likely to get prostate.
4 times more likely.
More likely.
No, I think the stat is 4 times more likely.
I think it depends on it's when you put all the other things in together, but it's certainly at least doubled.
Yeah.
And it may be as high as 4 in certain, because again you can split it down. But the other thing we don't understand is Asian men are less likely than white men or black men to get prostate cancer. But less likely doesn't mean you won't. That's the important thing. And more likely doesn't mean you definitely will.
Yeah, of course. I actually got checked after my dad passed away, I think 2 months after. And I know lots of people have so many fears about getting checked because it's intimate. And as men, we're scared of going to doctors, admitting that we're slightly broken or unwell. And I've got to say the process was really swift. That was the first thing. My second fear that I had was it was going to hurt. I mean, I didn't love it, but in 2 minutes, I knew exactly what was going on, the outcome of it. So anyone who has any of those fears about having to drop your trousers, expose yourself, it is as discreet. They do try and make it as comfortable as possible. And for the small uncomfortable moments that you feel, which takes about 2 or 3 minutes, it could potentially save your life. I guess that is the message that should be taken away, right?
Oh, definitely. I mean, as a doctor, I've done dozens of prostate examinations, hundreds, maybe even thousands. As somebody who was diagnosed with prostate cancer, I've had it myself, and I totally agree. You wouldn't choose to have it done. It can be mildly unpleasant. It should not be painful. If you've got other problems down there, if you've got piles or something like that, speak to the doctor first. You can have local anaesthetic jellies and things. It sounds like a really primitive test, having a finger put in your back passage. You know, we live in an age of MRI scanners and artificial intelligence. Why is he sticking a finger up my bum? Because that's the only, you asked about can you self-check? That is the only way you can check a prostate gland out without any kind of high tech. And you can tell from that, is it bigger than you'd expect for the age? Does it feel normal, or are there lumps in it? So there are things that can even at that stage make the doctor think this is not a normal prostate, this is potentially cancer, and then act accordingly.
Okay, on that point, cancer, that is the big worry and scare for everyone. But it's not a simple equation. Not every symptom or negative symptom does equate to cancer, right?
No, absolutely. As I said, you have all kinds of other symptoms that can be down to lots of other things.
Yeah, okay. Early diagnosis, that's imperative, isn't it?
That is absolutely crucial. If you have prostate diagnosed at its most localised stage, there's almost 100% chance you'll still be around 10 years later.
That's unfortunately how my dad died, because he didn't get it treated or diagnosed early, and by the time it was diagnosed, it'd gone too far. So I couldn't underline more how important it is to get diagnosed and seen early. What treatments are there if you do have prostate cancer? I guess you're currently going through one of them.
Yeah, it varies according to the stage at which you're diagnosed. So if you're diagnosed early and the cancer's totally inside the prostate gland, it hasn't had a chance to spread anywhere else, then your options really are going to be surgery or radiotherapy. And with both of those, if it's treated, like I say, 10 years' time, there's probably 100% chance you'll still be around. Once it spreads past the gland itself, Surgery's not going to get rid of it, obviously, because it's in other places, whether it's still within your pelvis or elsewhere around your body. So you're then looking at, again, maybe radiotherapy, but to a wider area, hormone treatment or chemotherapy. And there are other treatments even further down the line. But those three are the main things. And I'm having all three of those, so I had all three of those.
And how do you feel having the treatment yourself?
To be honest, it's no fun. You feel lousy when you're having it, but afterwards, it takes time to get over it. Yeah, you'll feel tired, you feel washed out, you'll feel generally pretty ropey, but you do get over it. Still got all my hair after the chemotherapy. So,
Looking great.
Yeah, so it is a tolerable treatment, and it's sure as hell better than the alternative.
Yeah.
And again, the message is, I did everything wrong and got diagnosed late. Get checked out early if you've got any kind of symptoms and get it treated early.
What can we do to minimise the risk of prostate issues?
Okay, well, unfortunately, we can't reduce our risk of growing old. That's going to happen. We can't change our ethnicity. That is there. You just need to recognise those as risk factors. The biggest risk factor that we can do something about is obesity. And you might think it weird that obesity can actually contribute to prostate cancer, but studies have suggested that for every 5-point increase in BMI, your risk of actually dying from prostate cancer goes up by 10%.
Oh, wow.
So that's quite significant. So, it's the really boring usual message: healthy lifestyle, normal weight, healthy diet, and again, anything that you're worried about, anything that's not normal for you, get it checked out.
Isn't it interesting that the underlying information that we've given with regards to anything, especially over the last couple of years of COVID, it was wash your hands. It's basic, simple, healthy routines that make such a massive difference, right?
We're designed to operate in a certain environment. Anything you do that upsets that, whether it's diet or hygiene, is bound to have a detrimental effect on your body.
Tim, thanks so much for precise, concise and honest information on that. Unfortunately, there's plenty of misinformation on that. So can we talk through some of the myths?
Absolutely. More than happy.
And the first one is surrounding my personal experience. So my dad was 81 when he died from prostate cancer, but is it typically an older person's disease?
It's certainly more common as you get older. You go, yeah, definitely. It's pretty well unheard of under the age of 40. Incidence starts to pick up about 55, and then it just climbs. Anybody over 70, there's a pretty high risk of it. Once you get beyond 70, you start dying of other things, so the risk doesn't go up any higher. But yeah, it's more common when you're older, not unheard of when you're younger. So just because you're 30 doesn't mean you can't have it. Again, if you've got any symptoms that you're at all worried about, you need to get them checked out.
I'll tell you a true story. So Harlequins actually set up a prostate cancer hub. So the capacity here is about 15,000, and they invited people to get their prostates checked, because as men, sometimes we just need a little bit of a nudge. And of the people that came through the gates, there was a couple of hundred people who had symptoms of prostate who would never have known. And just by doing that, so it does go to show that, like most diseases, it doesn't discriminate. If you're young, that doesn't mean you're out of the woods. So I guess the message is just be cautious and listen to your body and get regular tested, right?
Absolutely. If you're at all worried, yeah.
Okay, cool. The next one is the prostate examination is painful. What would you say to that?
Shouldn't be painful. It's potentially embarrassing because it is an intimate examination. I can understand why some people might find that difficult. It may be slightly uncomfortable, but it really shouldn't be painful. If you've got problems like hemorrhoids, piles, that kind of thing in that area, speak to the doctor beforehand. There are things they can do, like local anaesthetics, to make it less painful, hopefully not at all painful, and you'll be put at your ease and made to feel comfortable. And it's a very short process, and it's certainly worth it.
Yeah, I did it last year. Only took a few minutes. The biggest fear was just the embarrassment, but I'd rather be feeling slightly uncomfortable and embarrassed than knowing that I've actually got prostate cancer. And I'll tell you what, for a few weeks, and of course this all related to my dad, but having that burden lifted off my shoulders by just having that clarity and knowing that I was okay with it, that is absolutely well worth just feeling slightly uncomfortable. Definitely. Which is spot on. Okay, cool. Next one, should I be getting my PSA levels checked regularly? Can you just explain what a PSA level is in the first place?
Yeah, there's a lot of publicity about PSA. PSA, prostate-specific antigen. So it's a chemical that your prostate gland produces, and it produces it all the time, whether it's healthy or not. Consequently, the more prostate you've got, the more PSA you're liable to produce. Cancer means you've got an awful lot of cells growing very quickly, so again, the more PSA you're liable to produce. But it's not incredibly accurate. 3 out of 4 men with a raised PSA will not have prostate cancer. They may just have a prostate that's too big because they're getting older and it's growing slowly over time. Could be inflamed, could be infected. All of those things will put your PSA up. More importantly, 1 in 7 men with prostate cancer will not have a raised PSA.
Okay.
So again, it's about awareness of symptoms as much as anything else.
Because when I was doing my research about prostate cancer, I saw you could buy these tests online about £20-25, which check your PSA levels. And what you're saying, I guess now for sheer clarity, is yes, you can get it, but it's not going to give you a definitive answer. The best way is just by seeing your GP.
Absolutely. Your online test doesn't come with a pre-packaged doctor with it.
Yeah, fair play. Next myth to bust is the worries about the long-term side effects, but I guess that's dependent on what treatment you have, because there are various ones, aren't there?
Absolutely. So let's work our way down through the list, shall we?
Yeah.
So surgery first, particularly if you've got localised prostate cancer confined to the gland, you choose to have surgery. That surgery involves removing the whole prostate gland. Because of where it sits underneath your bladder, because it's involved in diluting down the semen, you might be worried, well, that's going to affect both my urinary function and my sexual function. And is there a risk of impotence? Is there a risk of incontinence? Surgery has got much more refined nowadays. There are ways of making sure that you spare the nerves that help you get an erection. There are very refined robot-assisted surgeries as well to make sure you're just removing the prostate gland and nothing else. So those kind of side effects related to surgery are becoming increasingly less common. And should they occur, and it's rare, there are plenty of treatments that can help with those. Second treatment you're liable to have, whether your cancer is just confined within the prostate or if it's spread a little bit locally, is radiotherapy. Radiotherapy has the advantage you're not removing the gland surgically, so you don't necessarily have that nerve damage risk. What you are doing is passing radiation through your body to hit the prostate gland.
Yep.
So that radiation goes through everything else that gets in the way. So the concerns there are you going to get problems with your bladder again? Is it going to get inflamed from the radiation? Well, the answer to that is we've got much more tightly focused forms of radiotherapy now that really do just target the prostate gland. So those bladder effects now are much less. The other thing, because of where your prostate is are you going to get problems with your bowels? People talk about diarrhea and things like that because of the radiation going through your bowels. Now there's a technique whereby you put a spacer before you have the radiotherapy that stops the radiation damaging the rectum. That means you don't get the bowel symptoms as well. So we're getting on top of the side effects from radiotherapy. The next thing that you might have, particularly if you've got more advanced prostate cancer, is hormone treatment. We know that testosterone feeds the prostate gland. That's the male hormone, which we'll hear an awful lot about. So there are drugs that block the effect of testosterone, and they're very good at controlling the growth of prostate cancer. They do block the other effects of testosterone as well, so you are liable to notice a drop in your sex drive. You will put on weight. You might start finding your body shape changes a little bit, to put it mildly, and you're liable to get hot flushes. But those things, again, they're controllable. So chemotherapy is another treatment that you might have, particularly if your prostate cancer has spread. It's not as bad as some people think it might be. I've had it. The main side effect is it makes you feel tired, but then a lot of treatments can make you feel tired. There are ways around that. Keep up your exercise levels before you have your treatment. That helps. I didn't lose my hair. There are ways of making sure you keep your hair. And really, beyond that, maybe I was just lucky, but I've not had great problems from it. So it's not something to be scared of.
Anyone going through chemotherapy like you've had, radiotherapy or having surgery, what are the relative times for recovery from those different treatments?
In terms of recovery, the surgery nowadays, if you have robot-assisted surgery, you're in and out of hospital in a couple of days. It might take a couple of weeks until you start feeling like you're peeing normally, but after that, that's fine. Radiotherapy takes a bit longer because, again, depending on the kind of radiotherapy you have, the treatment could take, if it's localised cancer, the treatment takes about 4 weeks anyway, and it can take you 3 to 6 months to get over that. If it's spread a bit further, the treatment lasts 6 or 7 weeks. It takes correspondingly longer to get over it. Chemotherapy, the side effects, they'll last while you're having the treatment. You may get longer term side effects from the chemo, which sometimes can take months for you to get over. but they usually ease off over time. And the hormone treatment, once you stop taking it, the side effects from that will go.
Thank you. Next one. Masturbating or ejaculating too much can cause prostate cancer.
When I was at school, you can imagine there were all kinds of stories about what's going to happen if you masturbate too much. Funnily enough, prostate cancer was never mentioned, and none of the other things happened either.
Yeah.
So there's no evidence whatsoever that excessive masturbation or excessive ejaculation will cause prostate cancer. There was some publicity a few years ago that said actually regular ejaculation might reduce your risk of prostate cancer. Sorry guys, that doesn't happen either. There's no evidence for that.
Where do these myths come from in the first place? Because whether it's going online, chatting to your friends, but it seems to be these fables which turn into myths and the myths turn into truth and bleed into all of our consciousness, and they become fact, but they're quite simply not, are they?
Generally speaking, they're not. I mean, some of them go back an awfully long way, and little boys, as their bodies change, have always invented stories to try and explain it and say this is what's going to happen, particularly if somebody's ahead of them. But, you know, it's difficult. We live in an age now where there's an awful lot of data out there, which doesn't mean there's a lot of information, which doesn't mean there's a lot of knowledge or a lot of facts. There's just a lot of stuff, and it's kind of what you do with that stuff that really matters.
If in doubt, speak to a professional.
Absolutely.
Okay. Next one. Prostate cancer is genetic.
There are undoubtedly some genetic risks associated with prostate cancer. If you've got a family history of prostate cancer, particularly if it's a younger male relative who's had prostate cancer, that undoubtedly increases your risk. We don't know exactly what the genetic element is, but black men are considerably more likely, between 2 and 4 times more likely than white men to get prostate cancer. Conversely, Asian men are less likely to get prostate cancer than white men. Presumably that's genetic, but we don't know exactly what.
It's so bizarre with all the medical science technology that we have, because that's a stat which I've been made aware of, but with zero explanation. But I guess the most important thing is just being aware of it.
Absolutely, yeah. And you know, if you fall into one of those particular ethnic groups, if you've got a male relative who had prostate cancer relatively young, then if you're worried, go and seek advice.
Good man. Next one. The only thing that can go wrong with a prostate is cancer, but are there any other things?
It's like any other organ in your body. There are other things that can go wrong with it. Your prostate gland will get bigger as you get older. So that's not normally a problem for a lot of things. Again, because of where it sits under the bladder and around the tube that you pee through, that might cause problems with urination when you're older. It's normal to get up once or so at night when you get into your 60s. It's normal to pee a lot if you've had half a dozen pints. But if you start peeing more than normal under other circumstances, or if you find it's difficult to pee, that might be a sign that the tube's getting constricted. That could be a sign that your prostate's getting bigger. Hopefully it's getting bigger because you're getting older. Could be getting bigger because it's cancer, so that's worth being checked. It can get infected. It can get inflamed. So if it gets infected or inflamed, it gets angry, it gets painful. That might come across as pain when you pee. That might come across as blood when you pee, or even blood in your semen sometimes. So again, those are not normal symptoms and you should get them checked out.
And finally, can people call Bupa if they're worried?
Absolutely. There are several channels you can use. There's a Bupa website, there's a Bupa Touch app on your mobile, and we have an Anytime Healthline phone number that you can call 24/7.
Tim, thank you so much for your
You're
time
welcome.
today and for all your valuable information. And of course, if there's anyone out there that needs any more information or support, do visit the Bupa website. Thank you so much for tuning in. Hopefully you found it helpful. Take care and stay safe.